Hey everybody, it's Kimberly with Fun For You In-Home Pet Care, and today we're starting a new series called Meet the Veterinarian. And I'm going to introduce you to a bunch of local veterinarians talking about what their capabilities and passions are for pet care, how to interview a veterinarian and find out what's the best fit for you and your pets. But first, I want to introduce you to my longtime friend and the person that actually got me into the pet care business, and that is Dr. Robin Downing of Windsor Veterinary Clinic in Windsor, Colorado. Dr. Downing is first of all, a veterinarian, her DVM. She's got her MS in bioethics. Then she got her doctorate in bioethics. She is the hospital director of Windsor Veterinary Clinic, as well as the Downing Center for Pain Management. She was one of the first veterinarians in the country to actually get certified to practice medicine for pain management in pets. Had never been done in the veterinary field before, and Dr. Robin was one of the first. She's also a canine cancer specialist. She's written books. She speaks at seminars and workshops. She's an amazing vet. And I was fortunate enough in 1996, when I moved to Colorado with my dog Cinder, I needed a veterinarian, and Dr. Robin's office happened to be close by to my work and my home, and that's how I found her. But more importantly, I found out what an amazing veterinarian, what an amazing person she was, and she became a lifelong friend of mine. She is the reason I got into becoming a pet care professional. She is the reason why I got certified to practice for special needs pets. She was the one that encouraged me if she could refer all of her special needs pets to a professional pet sitter that knew how to administer medications and take care of hospice type pets and pets that had injuries or illness, she could refer a lot of business. And that's what started me on this journey that I've been on for the last 15 years. In 2009, she sat down with me and said, focus on pet care if you need to make a change in your career, which is where I was in my life. I was going through a big life change. I was going to have to change careers. I was probably going to be moving back to California, which I did, but she's the one that said, your passion for pets and what you could do as a pet care professional would be priceless to veterinarians if you would focus on special needs. And so that's what I did. And so I'm forever grateful to Dr. Robin because she started me on this path of being a pet care professional. And today we are still great friends, and I just love her. She inspires me. She continues her education constantly. She's always getting more certifications, more credentials, more knowledge and experience and expertise in how to be better at taking care of animals. So she is my trusted friend and colleague. I have the utmost respect for her. And today I'm going to introduce you to Dr. Robin, and we're going to talk about the top 3 things she thinks are most important to ask when you're interviewing a veterinarian to take care of your family pets. If you were a pet owner and you were interviewing veterinarians, what are the top 3 questions that you would ask your prospective veterinarian?
So 3 things that any pet owner should ask their veterinarian or prospective veterinarian. I actually expanded this to 4 because I think there are 4 important things. Honestly, this is no different from interviewing someone to be your personal physician, in my opinion. I think is that a prospective client coming into a new veterinary practice should walk in and ask, can someone on your team give me a tour of your practice? Unexpected, not scripted, random visitor. And that gives you, as the pet owner, an absolutely essential read of the vibe of the practice. What's the practice culture? Because the practice culture will actually be reflected in the level of care that they provide, trickling down to the most minuscule, unimportant part of the care that they provide. And so, may I have a tour of your facility? Also gives you, the pet owner, a chance to speak to a staff member away from other people. If they're really enthusiastic to talk to you about what they do and how they do it, and they're proud of the practice, this is really an important foundational piece, I think, for choosing a particular practice. Second thing is asking, is your practice a certified fear-free veterinary practice? Fear-free medicine is about taking the pet out of petrified and putting the treat into treatment. And a fear-free certified veterinary practice already embraces all of the concepts, the philosophies, and the techniques to create a positive visit for a pet, whether they're a cat or a dog. Now, if they're not a certified practice, the next question to ask is, are your team members fear-free certified professionals? If they're fear-free professionals, then it may just be that there's, for whatever reason, an impediment to having the practice be credentialed formally as a fear-free practice. But if the majority of the team are fear-free professionals, then the odds are pretty good that the care that will be provided will, in fact, be fear-free care. The third question is really going to have to do with whether or not you have a cat as part of your animal family. If you have a cat as part of your animal family, you should ask, is this a certified cat-friendly practice? And then the fourth pillar of this, I look at this as 4 legs of a table. The fourth pillar is to ask if the practice is certified by the American Animal Hospital Association. So the American Animal Hospital Association, AHA, is the credentialing organization that is committed to helping veterinarians provide excellence in companion animal care. But we agree to adhere to many hundreds of standards of care that really cover everything from how we keep our medical records to how we monitor anesthesia patients and how we take care of our patients when they're in the hospital, as well as how we take care of them when they're in the exam room. So these 4 areas, I think these are really critical areas for any pet owner to really pay attention to when they're looking at possibly patronizing a particular veterinary practice.
So your comments about the vibe and the culture and the, whether or not they've got certain certifications, you have a lot of certifications and acronyms behind your signature on your email and everything. And I know from meeting you back in 96, you were growing your business and you were just starting out, but you were getting into canine cancer and you were getting into, learning how to manage pain better. And I think you were the first veterinarian in the nation to get certified as a pain management specialist. Is that correct? Or you
So,
towards that?
yeah. So I certainly have spent an awful lot of time on my postgraduate education. And so the credentials that I currently have include one of which I'm particularly proud, and that's my Diplomate status in the American Academy of Pain Management. So I was not the first veterinarian, but I was the 3rd veterinarian in the world to credential as a diplomate in this human pain management organization. Wow. I was the first veterinarian in the world to credential with a 2nd human pain management organization called the American Society of Pain Educators. And it was all about learning how best to communicate complex concepts around pain and pain management to both a professional audience and a layperson or patient audience. I'm also credentialed as a medical acupuncturist and a medical massage provider for dogs and cats. I'm also credentialed in animal chiropractic care. And one of my more recent credentials was earning my diplomate status in the American College of Veterinary Sports Medicine and Rehabilitation. So how that really evolved is that each piece that I learned, each pain management technique that I learned, physical medicine now to complement the pharmacology and nutritional part of pain management, each time I would learn a new physical modality in the most recent part of my ongoing education, I actually have become a clinical bioethicist on the human side of medicine. My interest in clinical bioethics was really fostered by my experience back in 2010 of helping my mother have what I consider the best death ever. I was the privileged to be her medical advocate and to facilitate what was really a very peaceful, beautiful, and pain-free death. And that really sparked my interest in understanding that not everybody gets to die that well. But my long-term goal here and strategy is to create an encore career. What will I do when I am no longer practicing veterinary medicine? An encore career to work in human medicine in the end of life space, to really facilitate difficult conversations around death and dying. Clinical bioethics is all about making difficult decisions at the bedside in veterinary medicine, difficult decisions at the cage side or the table side, and to facilitate those conversations based on sound ethical principles, which takes away the impulse for us to just kind of fly by the seat of our pants. It really allows us and empowers us to understand that we're making good decisions based on sound principles for the best interest of the patient, whether that patient is a dog or a human.
I'm seeing a lot of troubling trends in nutrition and toxicity, things that are going on in pet food and pet diets that are are disturbing to me, because it seems like we're seeing a lot more canine cancer, we're seeing a lot more feline diabetes and things. And so in your experience, in your practice, what do you feel like is the greatest threat to pets in our culture today as far as their health?
Well, this is a pretty easy one to answer because the single greatest threat to overall pet health is actually the same greatest threat to overall health that humans face, and that's obesity. Obesity
Yes.
wins hands down. Now, I want to make a sidebar comment about nutrition before I move on, because here is where we now understand that there is an unfortunate expansion of what are referred to as boutique diets. These are boutique companies who have decided to buy into the pet nutrition, the pet food industry, the pet industry, and what they have done consequently is to create a tremendous amount of marketing, because they're marketing companies, because they're not owning their own manufacturing. Quality control is not under their control, so they really don't have a way of knowing how products are created. I have a problem with that, both as a pet owner and as a general practitioner veterinarian, but also because I've dedicated over 20 years of my career to ongoing education in clinical nutrition. So I'm painfully aware of the weaknesses in how these products are manufactured and how they're regulated. So it's important for pet owners to understand that they really do want to stick with companies that are A, committed to owning their own manufacturing from start to finish, and B, committed to only sourcing their ingredients on US soil. So setting that aside, why is obesity such an issue? Well, because it has so many consequences. The most important consequence is the development of diabetes. And what's very interesting in cats is we know there's a straight line between a cat who is obese and a cat that becomes diabetic. And it is not a function of if they'll become diabetic, it is only a function of when. And that is a very complex disease to manage. We do have some newer tools besides insulin that we now have available to us to treat cats with diabetes. But the best way to treat cat diabetes is to prevent it from happening in the first place.
Yes.
Diabetes can also happen in dogs. And again, straight line between obesity and diabetes. Other consequences of obesity that we can prevent by paying attention to appropriate calorie intake include osteoarthritis. It is true that there is a very, very direct causation relationship, not just correlation relationship, between a lifetime of obesity and early onset osteoarthritis. We also can get into issues like fatty liver disease. And with all that extra weight, that's a tremendous stress on the heart and the circulatory system.
Yes. Yes.
And it also decreases the amount of lung space in the chest. When the abdomen is filled with fat, the diaphragm is pushed forward and the lungs can't expand to their normal capacity. So now we've been impinged on respiratory function as well as cardiovascular function. It's really important for pet owners to take advantage of the fact that veterinarians are actually trained in clinical nutrition. And we really should be the best source for helping anyone choose what is going to be the best for my cat. How can we be the best people we can be? And in this case, how can we be the best pet owner we can possibly be? One last comment about nutrition is understanding that optimal nutrition isn't only about our quantity that we feed, how much we feed, but that we do need to pay attention to the specific formulation. So that, for instance, if in an aging pet, I'm dealing with an animal that has, for instance, chronic kidney disease, it's important that not only do I control the portioning, but that I actually am using a nutrient profile that will support that pet, cat or dog, who's experiencing chronic kidney disease, which is the most common clinical disease in cats and dogs over the age of 8. It actually occurs more commonly than even cancer. We think cancer must be the most important disease that old pets experience. Chronic kidney disease actually outstrips it. And so we now know that we have nutritional products, nutrient profiles that will actually support those kidneys that are compromised. And I've had animals live 5, 6, 7 years after their diagnosis with nothing more exotic than appropriate nutrient support. So it's a really important aspect of really leveraging your veterinarian to help you make the best choices.
Yes, I could not agree more. The partnership that our pet owners need to have with their veterinarian and building that strong relationship and partnership with a veterinarian, I think is paramount to a very long life for your pets because you have that chain of communication, that open communication where you can, bounce ideas off of them and say, hey, what is happening here?
You've asked for some final thoughts, and I think it's so interesting that one of the things you just talked about is this relationship building piece. Because my closing comment, and I so appreciate you making the time to have this conversation with me, is that prevention beats intervention hands down. So what does that really mean? Well, it really means doing what you just suggested, which is creating a relationship with a veterinarian or with a veterinary practice, because so many practices now have more than one veterinarian involved. Most of the time, not all the time, veterinarians are humans too, and we sometimes aren't that smart about the people we hire. However, most veterinarians hire like-minded, like-hearted people so that the culture of the practice is engaged by everyone who is in that practice. So it may mean making a relationship with a practice versus with a single veterinarian. But the bottom line is that relationship allows for continuity of care. And then finally, one last comment about cats in particular, that is another area where I've been able to serve as an advocate across the U.S., and that is to never, ever, ever, ever subject your cat to toe amputation. So we used to sanitize this procedure by calling it a declaw. It's not a declaw, it's a feline toe amputation. I am hoping that before I die, that I can see this banned everywhere.
Right.
So I'm so happy that you've given me this opportunity, this platform to talk about keeping pets happy and healthy. And I'm so
Yes.
grateful that you've chosen to focus your attention on those animals that are reaching a time in their lives, whether they're young or they're old, where they have some special needs. And those families deserve to have an opportunity to have some respite from the
Yes.
care that they provide. And that's what you do. You provide trusted respite for them so that they can take time away. They can take the vacation that they postponed because they didn't want to leave their dog or cat by themselves with some random stranger. That they can take the time to, go to their kid's wedding in another state, or to greet the new grandchild that lives farther away than just down the road. So I'm really proud of what you've done and how you created this niche for yourself and filled a very important niche of pet care.
Well, I appreciate you putting it in my lap back in 2010 or 2009 when we first started the conversation.
Uh-huh.
So thank you so much. And thank you for your time, Dr. Robin.